So again, my name is Tim Bentley and I'm from Tucson Medical Center. I wanted to say hello to Dr. Theresa Cullen, who is the Pima County Health Department Director. Hello. Dr. Erica Labor, who is a pediatrician at Tucson Medical Center, TMCOne, and at TMC. Dr. Sean Elliott, who is a pediatric infectious disease physician at TMCOne, and Jessica Leonard, who is a fourth grade teacher at Butterfield Elementary School. And we're very excited to be here today. I know that we were expecting Mimi Kumler, who is our president and CEO at TMC, and unfortunately she's unable to join us today. She sends her regrets, but she knows that this is a very important topic for all of us, not only the panelists, but as parents and family members that are watching today. She wanted me to pass along that not only is she an RN, a caregiver, the president and CEO of TMC, she is a parent and she has two children. And they are both vaccinated, and she is a firm believer in vaccinations, vaccines, and making sure that our community is doing everything we can to keep ourselves healthy. So I will have some more information from Mimi throughout the day, but again, she sends her regrets, and we will get started. So Dr. Cullen, can you give us kind of the state of the state? What is happening since the CDC made vaccines available for those, approved for that age group? What are we doing here in Pima County, and what's happening at this point?
Okay, thanks so much. I really am feeling privileged to be on this panel with everybody else, and I hope we'll be able to answer your questions. I'm going to do the kind of brief Pima County Health Department overview that we do when we talk about what's going on with COVID. I'll share some specific data about what we're seeing in the 5 to 11-year-olds. I will just briefly mention the Omicron case that was just reported from Yavapai, so people are aware of that, and then talk about what vaccine opportunities there are in the county. So you may be aware we are in a state of heightened transmission, what we call accelerated transmission. We have about 350 cases per 100,000. We are seeing an increased number of school cases in the last 2 weeks. We work very closely with the schools, and I think Jessica will really share with you her specific experience as a teacher and what that means. In terms of testing, we continue to make testing broadly available. You may be aware the Board of Supervisors elected to give us access to a little more funding, so we will be able to expand testing starting next week. This is in addition to the testing that is occurring in the schools. That could either be through the school health program using an rapid antigen test. It could be through what we call pooled testing. A certain number of classrooms are participating in pooled testing where everyone in the classroom tests on a regular basis. And we have testing available through home kits available at the library or at our clinics and our Abrams Public Health Center. And finally, we have testing available at our laboratory sites that we support. Those are the ones that we are expanding access to. In terms of vaccination, as you know, we were 12 and over, then we went to the 5 to 11-year-olds. We've actually seen a very accelerated response in the last week. And I just want to share with you that last week we had acceleration in the 5 to 11-year-olds. 26% of the 5 to 11-year-olds in Pima County have had at least one vaccine. Now, remember, our denominator for that age group is about 88,000. We don't fluctuate it at all. That's from last year's census. So it may go up and down a little, but 26% is great. Last week, we were at 19%, so we still see a significant number. Vaccines are available at our vaccine, what we call points of distribution. That's at Abrams at the Public Health building. We also opened up at TCC, Tucson Convention Center. Both of these sites are open till 7. Interestingly enough, though it won't be interesting to you as a parent, you will understand we're seeing increased use of these sites in the evening hours by our parents with their children post-school, we assume. In addition, we have the vaccine available at multiple pediatric offices. I'm pretty sure Dr. Elliott can talk about that, and Dr. Labor, and at our 3 Pima County health clinics, where many people over the years have sought vaccination for the routine school-based immunizations at those sites. Overall, for those greater than 12, we are at 71% fully immunized, a really pretty decent number. We're at 72.6% for the entire county. So we're doing really well. We still have a ways to go. We're still having cases that are occurring on a regular basis. Our school team works closely with the schools. You may be aware the schools are, in a sense, mandatory reporters. They're supposed to know, let us know when they have a case, and then we do appropriate case investigation, and then what we call the contact tracing. I think, once again, other people on this panel can talk about that. So our priorities remain vaccination, stay home if you're ill, whether you're a child, student, staff, faculty, so you don't spread it. Follow what guidance we give from our contact tracers and our case investigators. And together, I think we are feeling like we're doing well. We do remain very concerned about the post-Thanksgiving increase. And as we go into the holiday season and people come back in January, we will remain concerned about what we will see there. So one of the most important things you can do, obviously, stay home if you're ill, wear a mask in school, and then once again, get vaccinated. So that's pretty much the state. The one thing I just want to spend, Tim, really briefly, Omicron. Sure. Omicron was diagnosed in Yavapai County. We work very, very closely with the state. We are participating in viral sequencing. There are no known cases at the current time in Pima County, but there is no reason to think we will not have Omicron fairly soon. And with that, it's just really important that people get vaccinated and keep themselves protected. Thanks.
Thank you, Dr. Cullen. That's good information. That's good to know. And we will circle back for our families and parents watching about ways that we can stay safe, even once we get vaccinated and get through the holidays. Dr. Elliott, Dr. Cullen talks about, the kids getting vaccinated and the numbers coming up and parents and families getting children vaccinated. But let's get right to it. Parents are nervous. Adults, we have, a year. Many of us started getting vaccinated a year ago. There's many, we've been talking about vaccines for 18 months. But kids, it's just started. What would you tell parents that have kids in that 5 to 11 age group range about the effectiveness or the safety of this vaccine?
Yeah, thanks, Tim. Absolutely great question. And thanks all for helping me join this webinar. I think it's quite reasonable. In fact, I would expect parents of kids in that age group to have questions about the safety of the vaccine, that this seems to have rolled out super quickly. And in fact, it's just been a year of vaccinating with the Pfizer product and then after that, the Moderna product. But it's important to know that the science, the discovery, the testing, that the objective research behind all of these vaccine research has been in place for the last 2 decades. I mean, I remember hearing about when I was in training, this is the early 90s, hearing about DNA and RNA vaccines. And so the concept is not new. The vaccine product may be just over a year old, but the actual concept and the safety studies and the anticipation of that is not new. That I think that's very important to realize. However, fast forwarding to a vaccine, which we're just now getting to see made available for ages 5 and up, of course, it's important to ask, is it a safe vaccine, first and foremost, and is it an effective vaccine? And the absolute resounding answer is yes to both questions. Based on data, that this is not just a magic wand waving and say, I think it's good because, nobody called and said it was a bad idea, but in fact, that the studies by Pfizer and ongoing by other vaccine manufacturers have studied well over 4,500 kids to look specifically for what are called safety signals. But what that means is when one is providing an intervention, a medication, a vaccine, even a sales product, which is non-medical, one looks to see, do reports come back to us from the community, from our providers? And to that regard, Doctors Cullen and Labor are critically important because they give us those reports. Are reports coming back from the community about unexpected adverse events or safety events? And that is the very best way to look for that. The Vaccine Adverse Event Reporting System, VAERS, VAERS, has been in place in this country for decades, specifically to capture things like that. So as the vaccine was tested in children ages 5 and 11, no safety signals came back, zero. Crickets, chirping in the night, which is fabulous news. Now, of course, there's been lots of other data, other research looking at older individuals, so ages 12 and up with Pfizer, ages 18 and up with the Moderna, and ongoing with other vaccines. And there have been, appropriately under intense scrutiny, some safety concerns. I would imagine many people on this webinar are aware of post-vaccine myocarditis, which very briefly is an inflammation of heart tissue, that the muscles which help the heart beat, in response to a self-attack induced by the vaccine. Now, that sounds scary, right? But it's important to know the vaccine myocarditis is incredibly mild. Nobody has had a severe outcome with that. Everyone who's experienced that has been, discharged from hospital or found to be 100% recovered within days or at most a couple of weeks after their event. Compare that to the myocarditis, the heart inflammation, which comes from the actual disease, from COVID-19 itself. First of all, there is a 10,000-fold higher risk, I'm not kidding, 10,000-fold higher risk of getting myocarditis from the actual disease than there is from the vaccine. And unfortunate patients who get myocarditis from the disease itself do not do well. I've treated those patients, and 6 months out, 1 year out, they can't even walk, a flight of stairs. They can't even walk down the block without getting out of breath. So those patients with disease-associated heart inflammation are super sick. So the absolute recommendation, looking carefully at the safety of the vaccines for all ages, is to proceed with vaccination. That's just one example. Many other possible safety signals have been looked at, have been studied extensively, have been found to be not related to any of the vaccine products that we have in this country. So I wish to convey an intense scrutiny, and I'm sure the others on this call will absolutely agree, a very intense scrutiny, looking for any reasons not to proceed with vaccine. We don't want to give a bad product to our children. And the overwhelming evidence has been it's safe, it's a good thing. Is it effective? Yeah, absolutely. In fact, for those on the call who have children 12 years of age and older, the Pfizer vaccine is 100% protective against severe disease. That's amazing. That's better than we do with adults, P.S. So for younger kids, we're just too early into the vaccine administration to the 5 through 11 to do long-term population studies, what basically based on data coming from the patients. But all the initial indications from the study are that it's at least 91% effective against all disease. So safe, effective, a super good idea. I do want to pick up on what Dr. Cullen was sharing. The Omicron variant, as we're now hearing, not unexpectedly has entered Arizona space. It was just a matter of time. It wasn't a thing we could avoid. It's apparently true that patients who have had natural infection with COVID-19 seem to be at an increased risk of reinfection with the Omicron variant in parts of Africa, like South Africa and Botswana, where it was first described. If that is in fact true, and it may well be, then vaccine is held out to be incredibly protective, especially vaccine with booster, incredibly protective against this new variant. This is what we have to do to protect ourselves and our kids. So that's a sort of a long-winded response, and I apologize for that, but it's important to be very clear that the safety and effectiveness of the vaccines for kids has been incredibly well established.
Thank you for that. I think that's reassuring for many on the call today. I just to clarify, what is the vaccine? What vaccine is available for children 5 and up, 5 to 18? Is it just?
It's just the Pfizer vaccine at this point.
Okay.
Data from Moderna, which is the other messenger RNA vaccine, is being provided to the FDA apparently as we speak. And so we can look for that coming up. But right now it is just the Pfizer vaccine.
And I think I hear you say that there's 20 years of studies on this and this vaccine and the science behind it. It's not just the last 6 months that they started investigating. It's 20 years.
Yeah, the concept is not new whatsoever. The product, yes, but the reason the vaccines were put together so quickly is because that science and discovery already was there. There's no way this could have happened as quickly with a brand new scientific product. No way.
Well, thank you. That is reassuring. Many of the questions that people, when they registered, they asked a question, and I think that answers quite a few of those. Dr. Labor, I wanted to ask you, and maybe Dr. Elliott, you can chime in. Many parents are dealing with children that have some chronic issues. Maybe they're diabetic or they have some other issues, and they're nervous about either side effects. And I do want to circle back on side effects, but maybe they're nervous about that because their child is already slightly sick. What would you say to a parent that's on that fence about with their child?
So I would understand their concern, but I would stress the importance of getting the vaccine as a protective factor given their other medical conditions. So it would be even more important for those high-risk populations to be vaccinated. And I would encourage them to do that.
So it's really like, I think Dr. Elliott, I heard him say the getting vaccinated far outweighs the long-term effects you might have if you get COVID just in general.
Right.
Is that correct?
So so even so, someone who is higher risk who does get vaccinated has a better protection if they were exposed to COVID-19, less risk for hospitalization and severe illness, compared to, the risks outweigh the benefits in a sense of being vaccinated, especially if you have a chronic illness. It would protect you far more than if you were exposed and unvaccinated.
So 2 questions for our medical folks on the line. There's some questions that I see here and that people submitted. What if my child and what if a child had COVID in previous 18 months or so? What's the requirement for them to get vaccinated? And then once they're vaccinated, what's the likelihood that they might have a breakthrough case? And Dr. Cullen, I don't know if you have data on that, or Dr. Elliott, if you've seen that.
I'll start with the first question first. And so I guess very importantly, just having had COVID-19 should not be considered protective against getting it again. We've seen that with the Delta variant currently in Arizona. We are seeing it now with the Omicron variant. And so it's very important for those who may think they're protected after having had the actual disease, that protection may last maybe 3 months, if that. So the need to vaccinate a COVID-19 patient or survivor is incredibly important. It's quite real. The timing, though, is interesting. So there's I think a misunderstanding in some parts of the community that you have to wait 3 months after having had COVID-19 to get vaccinated. That's only true if that patient received an antibody or monoclonal antibody cocktail or some intervention which would decrease their ability to respond to the vaccine. That's a very rare situation. Far more often, one just needs to wait for 10 days after diagnosis of the COVID-19 so that one is no longer contagious when you go to the vaccine center, the point of distribution that Dr. Cullen was talking about. Just 10 days. So anybody, that's fabulous. In fact, I've sent more than several children to their doctors to get vaccinated just in the last couple of weeks who had COVID just last month. So that's important. Breakthrough infections. I think that is a big source of concern and angst. And again, I'll ask for Dr. Cullen's input on any data we have, but yeah, they happen. They happen, especially with the Delta variant and very likely with the Omicron variant, because each of the variants is slightly more mutated than the past one, and thus a little bit less protected against by routine vaccine approach. So we know in adults that an increasing number of adults and even older children are being hospitalized with breakthrough infections. So they were vaccinated, they did the right thing, they're trying to protect themselves, they still got infected. They're not as sick, thankfully, as they could be, and that's a huge blessing, but they are sometimes getting hospitalized. So breakthroughs do occur. That underlies then the very strong recommendation based on our experience with our patients and people here in the United States, that the booster is very protective. Is it 100%? I wish everything I did was 100% effective, because then I'd be like king of the world. That'd be fantastic. But it's just not realistic. Yeah, there will be, and I'm sure there have been, mild, rare breakthrough cases, even in people who got boosted, and certainly in children who get both doses of the Pfizer. But those numbers are incredibly rare, and it's on a case-by-case basis. And Dr. Cullen, any additional input on that question?
Yeah, this is really a great question. We get asked it regularly. So if you look at everybody that's been vaccinated in the county, 1% of people that have been vaccinated have gotten infected. But if you look at the number of cases we have every month, so people that have gotten infected, how many of them are breakthrough? This can get a little confusing even to me. But in October, 26% of our cases occurred in people that were considered fully immunized. Remember, 2 shots Pfizer, Moderna, 14 days out, 1 shot J&J, 14 days out. In November, so 26%, in November we saw 28%. We're not in a situation where we are seeing lots of breakthrough yet in children, but remember, they didn't get fully vaccinated for a while. When you look at our breakthrough cases, the vast majority of them appear to be occurring at a minimum of 5-6 months after they completed their vaccination series. So the fact that we're not seeing a lot in children right now, I think just reflects the fact that kids started getting vaccinated later. And I would echo what Dr. Elliott said, the most important thing you can do is boosters. And that's why at the county, we actually got ahead of our skis, ahead of the CDC, and said anybody 18 and over should get a booster because we were seeing this increase in cases in the community. Thanks.
Great. Thank you. Jessica. Hello, Jessica Leonard is a 4th grade teacher in the Marana School District. Tell us, you're on the front lines. You see these 9, 10, 11, 12-year-old kids every day. What's going on at school? What are you hearing from parents? What are you hearing from your administration? And most importantly, what are the kids saying and what are they doing?
I think that overwhelmingly what everybody has been saying since March of 2020 when this first started is that we want kids in school. We know that it's the best for them. We know that there's no other place that they should be. And we also know that vaccinations are what's keeping students in school right now. Mask mandates are not currently in place in the district that I work in. And so we'll have positive cases. I mean, I couldn't tell you the last day that our district did not have double-digit cases. And what comes along with those positive cases are quarantining the students who are then exposed by them. And that can take out an entire classroom, which happened to me earlier this year. Mm-hmm. And if a student is vaccinated, then they don't have to go through that same quarantine period and therefore are in school and they're having the peer-to-peer interactions. They're able to engage with their teacher and they're getting the full instruction that they really are needing right now.
We have an administrator who's asked a school administrator who's asking a question, and you mentioned it a little bit. Maybe you can expand. What do we do to reassure parents that their children are safe, that their kids are safe in school and in your classroom?
That's a great question. We follow our mitigation plan that is in place. And the number one safety procedure that we have in place right now is washing our hands repeatedly throughout the day, just making sure that any chance that we can, we're washing our hands. We're trying to keep a distance between the students, but the classrooms aren't huge. So the distance between them is not as high as we would like it to be. And then we really just try to encourage, like if a student is sick, any type of symptom, please keep them home until we can ensure that they are healthy enough to be around their peers.
Okay, and so I can you maybe explain what your school district, your classroom or your school is doing? So if a child is exposed, but they're vaccinated, they don't need to quarantine for as long, or explain that a little bit on how your school might do that.
My understanding is that if a student is vaccinated, then the quarantine period does not have to go into effect for them. So if the parents disclose to the school whenever they make the phone call saying that their child has been exposed, that they are vaccinated, then they can return to class.
Okay, great. I'm going to defer to Dr. Cullen or Dr. Elliott or Dr. Labor on maybe what the advisement is. If your child is vaccinated and is exposed, what is the quarantine process or recommended quarantine, Dr. Cullen?
Yeah, I can tell you from the county perspective, what Jessica said is 100% right. And I'm sure she's learned this firsthand. If you are fully vaccinated, remember, how I describe that, then you do not need to quarantine. We obviously recommend that you mask. We would require masking if we could for that person, and test 5 to 7 days, in most cases 5 days out from the exposure. And we work with the schools. We don't rely on the schools having to remember all of this. So many of them know it by heart right now. And any decisions we make about what to do with a classroom when there's multiple cases in a classroom are done in conjunction with the teacher and with the school. And Jessica, I think you shared you had that happen in your class, or you just had a few cases.
We had cases, and then I actually ended up contracting it as well. And because of that, basically every student had been exposed. This was before the vaccine had been released for students at the grade level that I teach in. And so we unfortunately had to go remote again for the full 10 days of quarantine, which was a lot to do. It was a lot harder than I expected it to be. I was the remote teacher for the entire school year last year, and I really thought that I was like prepared. I thought I knew exactly what I was doing, but there's a lot of trauma that comes with being remote for an entire year. And I felt it, but my students felt it, and it was very hard emotionally for everybody.
Jessica, what's the number one thing that your kids are most excited about? They're back in school. I mean, what you see them every day. They're 10 years old, they're fourth graders. What are they most excited about?
Honestly, they just having the opportunity to be face to face with their peers, getting to see them at recess or just through the hallways during passing time. To see kids be able to interact in person is something that I never thought that I would prioritize as much as I do now, because I went an entire year without seeing it, but it really is such an important part of their youth and growing up.
Right. Thank you. I just want to reset. We're about 30 minutes in, and we are live tonight on Wednesday, December 8th, with our panel of experts, Dr. Erica Labor from TMCOne, Dr. Theresa Cullen from Pima County. We have Jessica Leonard, who's a fourth grade teacher in the Miranda School District, and Dr. Sean Elliott from TMCOne, an infectious disease pediatrician. If you are watching this another time, maybe you're watching it on YouTube or a video, you can still ask questions in the comments section, and someone at TMC will get that to the right panelist so that we can answer your questions. If you have questions tonight, there's a Q&A button at the bottom of your webinar, the bottom of your Zoom, that you can ask questions. And we've been answering some of those in real time. And Dr. Cullen or Dr. Elliott, the question, there was a parent who was asking, and Jessica answered the question too, about quarantining kids. And the question is if they're exposed versus contracted versus confirmed cases. So if they're exposed, or they're in the contract, or they're in the system, do they need to quarantine, or is it just if it's a confirmed case?
Sean, do you want me to, I can give you the county.
What's your guideline? And then Dr. Elliott, maybe give us some insight on the science.
So if you are a contact to a case, a confirmed case, PCR or antigen positive at a lab, or even proctored by a parent at home from a home kit, and you name your contacts, right? We work with the schools. Let's talk about the schools as opposed to home. We work with the schools, and the schools help us identify who's a contact. Remember, within 6 feet, can get a little funky sometimes, but the schools have been great. If you are fully vaccinated, you don't need to quarantine. If you are not fully vaccinated, you do need to quarantine. If you are around a suspected case, and that's a word we really try to stay away from, because it's so vague. What is a suspected case? Like, I think my kid may have had COVID, but we didn't test. So in that case, I would say it's really case-based. If people are worried at all that they've had exposure to COVID and they're not fully vaccinated, they should quarantine, I would say, until this suspected case is proven to be negative. And Sean, I don't know what you would think on that case.
Yeah. Thanks, Dr. Cullen. I agree completely. It may be easiest to think about it as to what's actually happening when you have somebody who's exposed to the virus versus somebody who actually has infection with the virus. And it all has to do with how much virus is in the nose or in the respiratory secretions, that those lovely droplets that when our kid coughs or sneezes in our face, we feel them on our eyeballs, right? It's, we've all experienced that. It's like, I'm going to get whatever that kid's got. So if somebody's only exposed, there's not yet infection. If they are unprotected by full vaccination, then their risk of getting infection without symptoms, not knowing that they're sick, and having that virus in their respiratory droplets, that their secretions, and being able to convey those or being contagious to others around them, that risk is no longer zero. So because we want to protect everyone around us, that contact of an infected person, known infected, who's not vaccine protected, has to be quarantined, even if they feel fine, because they may be sick, they may be contagious without any symptoms. The vaccine is important because that vaccine gives us tools, blocking shields, if you will, to reduce the ability of that virus to get into our noses, our respiratory droplets, and be shared through our coughing and sneezing. So that's why you've heard Dr. Cullen and several others say that vaccine is protective, do not need to quarantine in the absence of symptoms. As I think Dr. Cullen appropriately said, the real question is, how significant was the exposure, right? So, my child was in school with, or had a play date with, or at a sporting event with somebody who had a runny nose without other symptoms, was not tested, is not otherwise symptomatic. Kind of hard to think of that as COVID-19, because heaven knows there's other stuff out there, viruses, allergies, etc. Versus they had that same exposure, but somebody who tested positive for COVID, that's a real exposure. And it needs to be treated carefully, not just for the child's sake, but also for the sake of those around the child and their family. So that's why we're so very cautious about this.
Great, thank you for that clarification. I think that there's some people in our chat that they're saying thank you for that clarification. Dr. Laber, I wanted to ask you is, we're coming into cold and flu season, and not only do we have COVID to worry about now, we have children that are playing together, and we all know that they are, just a factory of germs. What are you saying to your parents, about keeping their kids healthy during this time, and what should they do? And a specific question that we had, maybe you can answer it first, is what about flu shots for their kids? Should they do that in conjunction or maybe at the same time? And then maybe expound a little bit on what they can do in the coming months to keep their kids healthy.
Sure, and I think it's especially important now that we're entering the winter months. So there's no contraindication to getting the COVID vaccine and the flu vaccine together. So patients can receive both at the same time, which oftentimes, creates less stress for parents. They get it all done at once. And, then they have protection against both. The second thing is, I think when it comes to just protecting against the virus, just doing the usual things that we should have been doing, this whole time, is hand washing, consistent mask usage. If parents can avoid taking their children to large crowded areas where they could be exposed to other viruses, those kind of things really can go a long way in preventing illness.
I always say that if my grandma Bentley was a nurse, and she would have. She was ahead of her time. She told, cover your mouth, don't touch your face, and don't all those things that we do. Grandma Bentley, she would have cured it right away. But I think that's good information about that, Dr. Laber. So thank you for that. Jessica, are your kids playing? Are they out playing? Are they wearing a mask? What are they doing? What's parents want to know, and maybe we can have Dr. Laber and Jessica answer this in conjunction, is, parents want to resume a little bit of normalcy. They want their kids to play. They want them to go to school. They want to go to a play date. Jessica, what are you doing for your kids? And then Dr. Laber, we'll go back to you and what you recommend on some normal activities.
So as I said, my district does not currently have a mask mandate in place. We had one in place for, I think it was about 6 weeks earlier this year, and we did see cases drop drastically during that time. But we don't have one in place anymore. So I would say maybe a third to one half of the students at my school choose to wear a mask, which is great. They are playing outside. We have normal recess time and everything like that. playing in the classroom, we really try to make sure that it's smaller groups who are playing together. It's not a large group joining together to play something that would put them too close to one another. I am also a mother. I have a 5-year-old daughter, and I know that we try to keep her away from large groups as well. So the playing happens, but it's just not the same as it used to.
Great, thank you, Dr. Labor. There's a question, and maybe talk about normal activities as parents vaccinate their children or families vaccinate their kids, and they're returning to normal activities. What's your recommendation on that? And then maybe what are some symptoms that they should watch for? I mean, we all know what a cold looks like or what sounds like. Are there specific symptoms they might look for, especially as COVID comes through again with some new variants?
Yeah, I think that's another bonus about vaccination is it can kind of lower the anxiety when it's coming back to sending your child back to school, because they are protected, doing sports or regular activities. And kind of to what Jessica was saying, last year I saw so many kids that just missed going to school or doing their regular activities. And now this year, I see them happy when they come in and telling me about their school experience. So it's really been a lovely change to see that in them. And I think that, the vaccination really does help it reduce the anxiety for parents.
Right. Jessica, I heard you say, yeah, go ahead, please, Dr. Labor, please.
Sorry, you asked about the signs and symptoms. So
yeah.
can be a little bit discreet in children. So, looking for signs of fever, cough, congestion. I have had some kids presenting just with diarrhea, ended up being COVID positive. So just being on the lookout for any changes in that way from their baseline.
Right. And then through the holidays, I mean, we're coming to family time and some other things. Is anything very specific that you would recommend to families? I mean, we know mask and the Grandma Bentley remedies, but is there anything very specific that families can do?
I mean, ideally, if everyone in the family was vaccinated, I think that could alleviate a lot of the pressure with the get-togethers, and then, limiting exposure in that sense.
Thank you. There's been a question, and it says, there's some adults in the household who are unable to get vaccinated for whatever reason, and then if their child is vaccinated, is there any indication that even if they're vaccinated, are there special measures, maybe Dr. Elliott or Dr. Cullen in the household that they should do if there are at-risk adults in the household?
Yeah, I'll take this one. It's a valid concern, and there are always going to be reasons that there might be an at-risk person, adult, grandparent, even sibling who could not get vaccinated. The key there, as Dr. Labor said, is to vaccinate everyone else around that person as much as is possible. We call it herd immunity or even cocooning. It's sort of like surrounding the at-risk person with as many safe people as possible. The holidays are difficult, obviously, because there may be large family gatherings with people with varying degrees of protection. And there are certainly many who just require a negative test to walk in the front door. Like, I want you to screen this morning before you come into my house because I have, Grandpa Joe who's at risk. It's great, it's wonderful, but a screening test is only at that point in time, and they're not 100% accurate. So I think one needs to balance the risks to that at-risk person of getting COVID-19 with the benefits of having a free-for-all family gathering and make some difficult decisions, especially as we are still with significant numbers from Delta variant in Arizona and other parts of the country, and with the unknown impact of Omicron. So any hard and fast advice, at the very least, understanding that family is critical at this time of year and every time, to wear masks, as difficult as that might be. And again, I go back to just what's happening in our noses and our airways when we're infected. It's having active virus. If we're wearing a mask, it's hard to cough anything through that mask, and therefore everyone around me is going to be protected. Another option might be to have the family gathering outside. Certainly here in Arizona, where we've got the best winter in the entire country, right? This is fantastic.
This is true. This is true.
And it's very true that the risk is much lower when we're outside, just because there's a much larger volume of air into which to absorb those droplets. So I think, quite honestly, one needs to make some very difficult decisions based on the risk to the loved one and whether others can abide by protecting that loved person.
Thank you. Dr. Cullen, I'll circle back with you. You said at the beginning, and maybe we've had some people that have joined, you talked about testing options that Pima County provides, and Dr. Elliott talked about that being one maybe option for a family to do. Where can families get tested, or what are the options? Are there any home tests or anything like that that are available?
Yeah, we have lots of options available. I did see a question in the chat, a family of 5, they can only get one home test kit at the library. So let me talk about what we have available, and that's a great comment. So we have home tests that we are distributing. They come to us through the largesse of the federal government and the state. I'd love to say we were the responsible, but I want to give credit where credit is due. Those are available at the libraries as well as Abrams Center, which is our public health center. We do collect demographic information on it. I just want people to know the only reason for that is we look at this from an equity lens. Part of the funding for this is through our equity grant, and we just want to make sure we're targeting the right population. Nothing else happens with that data. You can get only one kit per person. That is due to the supply we have available. We do know that some families come in with 3 family members. They can each get a kit. The assumption is that the kit is for the individual that is presenting to get it. You can also test at many of our testing centers, which are stand-up, as well as many of the pharmacies and physicians' offices and hospitals. There are also testing available at the schools. That is what we call proctored testing. That means that it's under the guidance of someone. Home testing is not under the guidance of anyone other than yourself. The instructions are good. There's also a QR code that takes you to a YouTube video, which will make it a little easier in case you get confused when you read the instructions. We also accompany that with hopefully you have gotten this if you've gotten the home test kits, with a 1-page what to do while you're waiting for your result. Wear a mask. If it's positive, what to do. If it's negative, what to do. So hopefully that is helpful. The supply is not endless. You know, there's lots of people talking about increasing the supply from the administration, all the current DC-based administration all the way down. We hope to see what we would call ubiquitous. That means all over testing. If you were in Britain right now, you could pay 99 cents and walk in and get a home test kit. That's not the situation here. As you know, they're much more expensive than that, but we're doing everything we can to roll them out as quickly as we can. Thanks.
Great. Thank you. We have about 15 minutes left, and I want to give everybody a last word and do a quick reset. If you're watching live on Wednesday, December 8th, you can ask a question in our Q&A for either Dr. Erica Labor from TMCOne, Dr. Theresa Cullen from Pima County, Dr. Sean Elliott from TMCOne, and Jessica Leonard, who's a 4th grade teacher in Marana. We will look at the questions, and if we can answer them, we will. I want to end. If you could make one plea, or if you had one thing to say to people here on the call that are on the fence, what would you say to them? Jessica, I'll start with you. If you had to say something to your parents or to people that are watching tonight.
I think that I would just say that, you know, like I said earlier, students need to be in school. We know that. And if a vaccine is something that's going to allow students to safely be in school and learning, then I really encourage you to lean into that and to get your child vaccinated.
Thank you. Dr. Labor, you see patients from newborns up to 21. What would you say to a family or parents of somebody who's eligible for vaccine?
I think there's just a lot of misinformation out there. So I would encourage parents to talk to their primary care provider, really have an open discussion, get their questions answered, and get, find reliable sources or wonderful town halls like this where they can ask questions.
Great, thank you. Dr. Elliott, I'll let you make your case, and I'll also say that we have 2 questions that just came through. I want you to tell us what you would say to parents and families in Southern Arizona about getting their vaccine, but the 2 specific questions: how common are false positives? And we did address it a little bit earlier, but if my child has asthma and pneumonia twice, is it safe for them to get vaccinated? And they're 7. So if you could answer those 2 questions and then tell us why you believe in vaccines for families and kids here.
Yeah, absolutely. Thanks, Tim. So to the false positive question, because today's testing kits and test science, I guess, are so very sensitive and so very specific, there are very few false positives. There are unfortunately more false negatives than there are false positives. And so whenever we have a test result that just does not make sense, either there's, lots of symptoms and gosh, I was sure that was going to be a positive test. We have to question the test result. However, a positive test most often does not lie. So we can trust that with pretty much the Grandma Bentley, gold standard, right? And you know what I'm talking about.
I do.
Yes, you do. To the unfortunate person who's had several bouts of pneumonia. Pneumonia is caused by many different kinds of things, not just viruses. It can be bacteria, but just having had pneumonia itself is not a contraindication to get the vaccine. However, having had pneumonia increases the risk of perhaps some scarring within the lungs. And so that person would be at higher risk to get severe COVID-19 if they were actually exposed. So if anything, I would take that person who had a history of recent infections affecting the lungs, the airways, the bronchitis, and say, you especially need to get vaccine protected as soon as possible. As a summary statement, several things I think are very important. First of all, I completely understand and respect anybody who has concerns about vaccine safety, indication, the mandates, et cetera, and so forth. I absolutely get that. And for those individuals, I would hope, as you heard Dr. Laber say, and Jessica as well, lean into that question, ask a trusted source for information about that. Please don't just go to the internet, because there's a lot of deliberate misinformation out there. In terms of the need for vaccine, both for our kids and our families, I cannot overemphasize that. I care for these kids when they're hospitalized in TMC with COVID-19. It's not pretty. It is not pretty. And these are kids who are suffering and is completely preventable. So I would encourage, if for no other reason, the personal safety of our children to get that vaccine, but also as a societal approach for the sake of this community, for the sake of the county, for the sake of the country. We're not going to get through this pandemic, and we will continue to get new variants until we can do a better job of getting everyone vaccinated who can be. That's just the sheer absolute truth. And we've got perfect proof of that coming to us right now from South Africa. So anybody who wants to talk vaccine safety, please give me a ring or an email. I'm happy to chat.
And we are getting some chats. And I think what we typically do when we put these videos, we will answer some questions that come in after the video in the comments. And if you are watching this on YouTube or on a video, you can put the questions in the comments, and we'll forward the questions to our panelists and get those back to you in real time. Dr. Cullen, Mimi wanted me to thank you and Pima County and in your efforts and partnerships with us and the medical community to really do good work and get our community vaccinated and safe, and our vision, really embracing the vision of community health. You live here. You see Pima. You're a director of Pima County, the health department. What do you say to families and parents of kids here in Southern Arizona?
Well, first off, I want to thank the community. It really has been a privilege to lead the health department during this. It's been a difficult time for our staff, difficult time for families, for the community. We say everybody knows somebody who knows somebody, and that other end is somebody that has had COVID or passed from COVID or been affected from COVID. So I just think it's important to note that our numbers keep increasing. The impact on the community is great. I want to echo what Jessica said, though. Teachers want to keep the schools open. We, as well as Dr. Laber, Dr. Elliott, do everything we can to keep kids in school, to keep businesses open, to make sure that TMC has beds available for you, as well as other hospitals. So it's just important for everyone to remember this is a community effort. And we are, from a public health model, public health communication is all about dialogue. It's not about saying you have to do this. Obviously, we truly believe in our hearts that people should mask, people should vaccinate. we also understand that people are at different places in their lives. And so the most important thing, and I really appreciate what Dr. Elliott and Dr. Laber have said, is reach out. If we can have a dialogue, if the issue is uncertainty, fear, lack of understanding, lack of knowledge, not knowing who to believe out there, please reach out and let us have a dialogue with you. Unless we respond to this as a community, meaning the members of individuals, families, personal communities, and then communities overall, I fear we will keep repeating this. And it's really hard for everyone. And so once again, we're always grateful to TMC because they've been an amazing partner to the health department, but really the partnership is with all of you who are listening. Thanks.
Dr. Cullen, thank you. And I think with that, we'll close tonight and say thank you to those that joined and asked insightful and hard questions. There are some answers that we're going to dig a little deeper and get some very specific answers for you. I will say that this is being recorded and will be posted on our Facebook page and our YouTube channel. I will send an email out to everybody that's registered. So if you're watching this in real time, you'll get an email with many questions answered and a link to the video. I see some of you asking about where that's going to live. I will send that link to you. To my left, Dr. Laber, thank you. Dr. Cullen, thank you. Jessica, Dr. Sean Elliott, thank you for taking care of our community. I am amazed. I'm no longer amazed at the hard work that our medical staff, nurses, frontline, our teachers. Jessica, you crush. Thank you for being there for our kids. Dr. Elliott, Dr. Laber, thank you for taking care of our children. Dr. Cullen, thanks for just being a rock star and helping us be smart about the science and everything. So for that, we'll call it a night and say good night. If you're watching this on video, ask us a question, but we will see you around the next webinar. Have a good night, everybody.